November 2nd, 2025, and driving you through this edition of the program are Angela Noah and
Melvin Stewart.
and of course, we have AB Salif, Communication Officer, who is here making sure that you get access to this program through the ministry's official Facebook page. So, however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For those of you joining through the ministry's official Facebook page, we'd like to encourage you this morning to like and share the live stream. Invite a friend to watch along with you. And to our dedicated radio listeners, I like to say it's always good to be here with you. Keep listening to this guest from the Ministry of Health, Mr. Agustin Nire, Coordinator, Vaccine Safety Surveillance at the Ministry of Health, Mrs. Elizabeth J. Doe, Supplemental Immunization Activities Officer from the Ministry of Health. The both of them are set this morning to take us through, provide valuable insights on the HPV vaccination campaign that is ongoing. Stick with us as we take a very short break to be right back.
Don't become a parent before your time. Before your time. You suffer so much and regret.
Welcome back and thanks for rejoining us. Melvin, good morning.
Good morning, Angela, and good morning, everyone.
Well, it's good to be here with you always.
Of course,
Well,
I'm happy as well.
welcome our guest this morning. I mean, as always,
Yes, I'd like to welcome Miss Nuri. Good morning, sir.
Thank you very much.
Oh, I'm sorry. Good morning.
Good morning, Melvin.
How are you doing?
I think I'm sitting pretty and I'm doing good.
That's wonderful. All right, Madam Dole, good morning and welcome.
Yeah, good morning as well. And thank you.
Your first time, right?
This is my second
Oh,
time.
your second.
a second time.
Okay. How are you doing today?
I'm doing great. And you?
I bless God for life.
Okay. Thank you.
All right, let's get into our discussion this morning. Let's hear from Mr. Neri. How is the EPI division at the Ministry of Health?
I think let me start off by saying good morning to those in Radio Land and those who are joining via social media. We say you are welcome to this discussion. The immunization program of Liberia, that is called the Expanded Program Immunization, EPI for short. I think we are trying to be strong and stronger by the days with different strategies and role to make sure vaccine services are delivered to every individual within the borders of our country and with different targets set for different vaccines in terms of what antigen we are enrolling. So the EPI is vibrant. We are moving on.
Okay. Let's hear from you, Mrs. Doe.
Yeah, okay. Just as my colleague has said, the program actually is interested in preventing diseases. That's what we go for, especially those diseases that can be prevented. So we try as much as possible to extend and expand our activities in all of the parts of Liberia to ensure that people get vaccinated. Otherwise, the program is doing good.
Okay. So I know that today our discussion focuses more on the HPV vaccine, providing more updates and as well as the importance of the vaccine. But before we deepen our discussion into that, I want us to firstly remind our listeners about, this condition, the cervical cancer. Or before going into the cervical cancer itself, what is the cervix? How is it different from the womb, or how are they similar?
Okay, so let me begin then. My colleague can add up. Biologically, the way God structured human being, it has its own layout. Males are different from female in a biological standpoint. So women carry something we call womb, and the womb has an opening. The way in which the baby is formed in the womb, it has to be done through sexual intercourse. So the content from the male enter through the cervix into the womb. So the cervix is a component of the womb. So it's like you have a balloon. You cannot blow the balloon with air if it doesn't have an opening. So that opening of the balloon is where you put the mouth to blow. So that is similar to how the cervix and the womb is like. So the womb is the entire thing that carries the baby, and the opening of the womb is what we call the cervix. So it's a part of the womb. That's how they are different.
Mr. Neri.
So I think I cannot say more than what Elizabeth had just described for us, but the whole thing is what we call the reproductive organ of the female gender. And it has three basic parts, the outside being the vagina, and the real, which we call the uterus or the womb, where the bed is for baby to lay in terms of conception. So between the uterus and the vagina is the mouth of that womb for entry into the womb, which we call the cervix, or which we call the cervix, the mouth of the womb, and the baby lying position is the uterus or the womb itself.
Okay. Yeah.
So let's you want to come in, Madam Do? You want to say something?
No, it's okay, but that's what he tried to describe. It is, I was just trying to make it a little bit common for people to grasp what we say. So, like I described the balloon, is the opening, the womb or the cervix is the opening of the womb, and the womb itself is where the baby lies until it reaches the point where the woman can give birth. So the way the sperm will enter the uterus is through the cervix. The way the baby will come out is also through that same opening before the baby can leave the womb, passes through the vagina during birth. So that's what happens. So when we are generalizing it, we just make it to look common so that people grasp the concept. We say womb cancer.
Okay.
Yeah.
And we understand that this womb cancer or cervical cancer is one of the causes of the deaths of women across the world, around the world, especially Liberia. Let's look at the infectious aspect of it. And because we understand also that males are the ones who normally carry this cancer, this disease, and at the end of the day, they don't get much. I mean, the infectious aspect is the one that hindered the lives of the women and all of that. So, what are some of the ways out before somebody notices that they have this problem, and they are not visiting the nearby health facility?
So I think that question is loaded, and we will try to unpack it and make it simple for those that are listening to us.
Yes, sir.
The disease, as we already have mentioned, it can affect both male and female. But as for the male, it doesn't show symptom or sign that what we call being asymptomatic. But in rare cases, there may be some conditions in the male, like the opening where the mouth and the nose are connected that we call the oropharyngeal region. It can cause cancer there, but those occurrences are very rare. So mainly it is the female gender, just as what we described, the part of the human body where the diseases can cause problems. So it affects both male and female. And we already have told you a couple of times and again, this disease, cancer in Liberia, one of the most notorious among them is the cancer of the womb, which we call the cervical cancer. I think the other day we were here with the doctor, and he explained from the clinical or from the hospital perspective. But we've come again with a follow-up message to tell the population, to tell the people on our voices, the prevention aspect is key, because the common saying in our country, prevention is better than cure.
And we want to understand, the people out there want to know why the HPV virus doesn't have doesn't have notable symptoms in terms of early treatment.
It does, but the aspect of it for which we are pushing prevention more is that by the time you get to classify this sign to be pointing to HPV, because it presents like any other condition, because we said that it comes through sexual contact between the man and the woman. And there are plenty of diseases that come in that form. Maybe from the early stage, it will appear like any of the STIs, like sexually transmitted infection. And you do the treatment, you do the intervention. Oh, and one of the critical things for our country, most times we will not go and seek health care from a professional setting. People can do their own self-medication or own diagnosis. They just feel the symptom, they walk to the drugstore, the medicine store, and buy whatever. The repetition of buying, the duration of buying, by the time they notice these medications are not working, then before they try to seek proper care. And by then, it might show late. So we are saying do the vaccination so that the issue of even you having the signs and symptoms for treatment to be initiated, it will be cut short. But more so, there are other interventions from a clinical standpoint. You can go for screening, and the age limit, I think, is 25 years and above for women to go for regular screening, where they will check that reproductive tract that we described earlier to make sure that there are no formation of some abnormal cells that will point to the clinical intervention to say, hey, something is happening, then the rest of the measure will be taken, which is another level of prevention that we talk of secondary prevention. But the primary we are going for is vaccination.
All right. The vaccine.
Yeah, Mrs. Don't want to add.
Yeah, so let me just add up to my colleague. Like he said, it's a little bit difficult to determine symptom as early as it is. You wouldn't know what is happening. So you will not be able to detect that this could be a cervical cancer because the symptoms, it takes time for it to start to show symptoms for people to know what exactly is happening. So that's why we are pushing prevention because before you realize or before you start to diagnose, they have already gone almost into a cancerous condition. And when it reaches that stage now, the treatment becomes difficult. Even though it can be treated, but it's better to prevent it from happening.
Mrs. Doe, let's talk about some of the things that contribute to this condition. Maybe there are some lifestyles or behavioral practices that contribute to cervical cancer, so the public can be aware of that. Then we go into the prevention aspect of it. Apart from the vaccine, what are other ways people can prevent, cervical cancer? And then we can go into how the vaccine can really protect them.
So there are some lifestyle that people like sometimes, like for instance, multiple sexual partner. You may not know whether he has it or I have it, and we are there. If it is possible that you just have just one sexual partner as well who could also have it, but you are not aware of who has it, so it has to take time. And another thing is that if you are a tobacco user, because tobacco also can compromise the system. So if you are frequently using tobacco, it will compromise your immunity and also predispose you to the condition as well. So those are some of the things maybe my colleague can add.
Yeah.
Yeah. So basically, you said it. So to do the prevention at that level, you are talking about cessation of smoking. You stop the tobacco intake, and then you try to modify your lifestyle in terms of your sexual activities so that you prevent yourself and then you prevent your partner or whomever. Or also around the sexual activity, there are a lot of prevention modes, use of condoms and other methods that will protect you and the partner you are interacting with.
Because remember, we said the condition is starting through sexual intercourse. That's one of the way you can actually get the condition. So if you are exposing yourself to too many persons having sex with you, or you are having sex with too many girls as well, you don't know who has the condition.
Okay.
Yeah.
Now let's look at the vaccine, the HPV vaccine. Recently, people launched a Monrovia in 15 counties benefited, especially 9 to 18 years of young girls on from various campuses, churches, and all of that. How did the launch go, and where are we before we delve down into some of the conditions attached to this HPV vaccine?
So as administrator, and we try as much as possible to create this awareness. We're on the radio. We went to Omni Radio as well. We talked about it. We have flyers all around, and in all of the 15 counties. We visited schools, we have PTA meetings, and just all of the engagement methods that we think we would have done. And we did that, and the campaign was launched on November 17th.
Mm.
But we had a national march here in Monserrado. So we teamed up with the Monserrado County Health Team, and we had a launch around the Pinsville belt, one of the schools in Pinsville, where the minister herself did the launch. So in that launch, we have uh, most of the ministry, the land ministries, we have education, we also have our gender, and we have other all of our partners represented at that launch.
After,
Let me just add, it's just a campaign aspect that she described.
yeah.
And a little to that campaign, we were gracious at that program when the office of the First Lady of the Republic of Liberia was represented to be the chief launcher for the vaccine to kick off on that day, November 17th. But just to digress, I mean, to take you back a little bit,
Mm.
HPV vaccine is not birthed in Liberia November 17, 2025. This vaccine has been around since 2016 when we did the first phase that we call the demonstration phase, because it has a new target age group that is above the routine age of children under 2 years to vaccinate. So we needed to learn more about the strategy around this vaccine. That's how come in 2016 we rolled it out in Bong and Nimba counties. Then after years of learning on the strategy, the delivery, the resource requirement, the human resource, the training aspect, we were able to roll it out into national routine immunization program in 2016. So it is part of our day-to-day vaccine or part of the vaccine we have in all of our health facilities that deliver routine services.
So let me add up. Like you said, that was a demonstration project that was held in those two counties. Later, we rolled it out in a routine program in 2019. So since 2019, all of the health facilities that are offering immunization services have this vaccine. We'll be doing the vaccine. We have had series of uh, intensive campaigns, activities across the country. We have been doing HPV vaccination all throughout since 2019 to present. But this recent one was just a campaign where we expanded our cohort up to 19 years. But over time, we have been vaccinating girls now to 14 years. So it has been in the program for more than 5 years.
What is the importance of this vaccine we're talking about?
The importance of the vaccine is to prevent the cervical cancer that we described. So if you are able to get vaccinated just with a single dose, it will help you to prevent the disease from occurring.
Does it give for lifetime protection to girls or women?
So the protection, the single dose protection is up to 98% efficacy. It's effective at 98%. So that means that even if you took just a dose, it's sufficient to protect you for lifetime.
So can you explain in simple terms for our listeners why, girls between those ages are being given the vaccine so that, people can understand the reason why we are choosing or you are choosing the age group at this time.
So the reason is that in our society, girls around 9 years now to 14 years, we don't expect them to be sexually active. Like you and I could be living with husbands at home now, where almost every day we're eating something. But, but it's not the case for the 9 years old girls. They are not thinking about sex at that point. So the vaccine is more effective if you have not had sex. That's why we decided to drop down as to that age. So between 9 and 14 years, we expect that girls are not sexually active. Even girls who are above 10 to 14 years, they may be having sex, but as far as we are concerned, they are not sexually active. So the vaccine can be more effective within our age group once they are not sexually engaged, actively engaged into sex.
It is just like the mobile phone we are using or the computer. The brand new one you have to program it before it brings out the services you want. So the 9-year-old girls, they are still naive. They have not started the sexual debut. They not started doing man and woman business yet. So if the vaccine is there to protect them, the day they become sexually active, then their own immunity has developed, their own fighting soldiers are developing their system to withstand that virus. So late on in age, they will set the screening time 25 and beyond. If you are already exposed to the virus, the chances of you, let me not use the word second word, the chances of you taking the vaccine in your body, making use of it to have the ultimate level, the highest level of prevention will be reduced. So the earlier the age, the better the vaccine works, and the safer they are from men and woman business. Because we said the sickness can come to the population through woman and man contact.
Mhm,
So
cool.
how many times do they need the vaccine and how effective it is?
So I say it again, you can take the vaccine just once.
Yes.
Okay.
But it doesn't also hurt if you took it more than one time. Because what vaccine does, vaccine generally, the more you take it, the more it's building up your immunity. But even if you just took one dose, it's enough.
98% safe for those that are supposed to take it. I'm keen to know as to whether the people who are poised to take this vaccine, they are required to pay some money before they take it, or is free of charge from the end of the Ministry of Health and Partners.
So first of all, let me say it's 98% effective.
Mhm.
So for people who are taking it, the vaccine is free. We are not asking for a dime. So for our listener, anywhere you going for vaccine or you may have gone for vaccine, somebody took money from you, it's not supposed to be. It's free. Ministry of Health is offering the vaccine free in all of the health facilities where we offer immunization services.
I like how you describe it. It is free, but the freeness of that is free to the end user of the vaccine.
Not just everyone.
But for the cost of the vaccine coming into Liberia,
Mhm.
it's paid for
Okay.
through a partnership with our vaccine alliance we call Gavi.
Mhm.
They provide 80% of that support, and government of Liberia gives the balance 20% for our vaccines to come in country. And in all our facilities, they are free at cost to the end users.
560,000 persons are to benefit from this process as tend to be corrected. Uh, uh, have we met the benchmark or we are approaching that?
So yes, we met the benchmark and we even passed the benchmark. We from the beginning targeted 560,000 when we're only looking at girls between the ages of 10 and 18. But later we included the 9 years old girls. So our target changed a little bit to 624,000.
Wow.
So around 624,000, we were able to vaccinate 665,000 plus.
Oh,
So meaning we exceeded
exceeded,
the
yeah,
number we targeted.
generously.
Yeah.
But in those instances, and please you are
Go
coming in
ahead.
those instances when you get to those places that you see girls or those who are supposed to benefit from this vaccine, what do you hear from them? Because this perception, traditionally, we believe in all sort of norms and cultural values. People say this thing is not good for my child. You give this thing to my child, they will not born again. All of that. I know you heard some of them, and you are still hearing them.
Yeah. So there were a lot of myth or maybe rumors around the vaccine, especially during the day of the launch. The girls, some of them were saying the vaccine will make me pregnant. And I said, no, the vaccine doesn't have a manhood organ to impregnate anybody. The vaccine will not make you pregnant. It will only help to prevent the cervical cancer. And some of them are saying the vaccine will make me, I will not born.
Mhm.
Yeah, and we are saying no, that it is not the vaccine that going to cause infertility. You will also born. Other people are saying the vaccine, when you take the vaccine, it can make you go now, meaning that you can be going from man to man. It increases your sexual libido, and then you wanting to have sex every 1 or 2 minutes. It's not the case.
So these sort of rumors, what they do, they help to strengthen the immunization program. Because if in the same one community, a segment is saying vaccine will make a girl pregnant, then the other component says vaccine will cause infertility. So then they neutralize each other right there. But what we say vaccines are for type of prevention. Based on the type of vaccine, a particular disease will be targeted. So vaccines do not give pregnancy. At the same time, they do not cause women to be infertile.
And I like the way Mrs. Doe put it. Like the vaccine does not have an organ, a male organ that will impregnate someone. It's not funny, but that's the truth. Vaccine does not have organs, so it obviously cannot impregnate a person. But let's talk a little about the side effects because maybe someone listening might be thinking about that because like some medications they have side effects that people are educated about. So for the HPV vaccine, does it have any side effects that people need to worry out for? Or if that happens, what do they need to do?
Yes.
Vaccines are like any pharmaceutical product. They are like any medical product, like drugs. They are things we take to help our system to overcome some weaknesses or deficiencies. So, like the HPV vaccine we are talking about, it's an injectable. That injection, the needle will juke you. So, part of the things you should expect or we expect is the site where the injection is administered, there will be pain and some level of soreness will be there. But those things should go away by themselves in less, I mean, in no time. But to help our system that will monitor, this is the work I do at the Ministry of Health, Vaccine Safety Surveillance. We have a system set up where in each of our health facilities, we have a person assigned that we call the health facility surveillance focal person. He is connected for the case of Monserrato to the zone or surveillance officer up to the district, county, before the national level, and then up to partners level and outside. What we do if you took a vaccine or your child received a vaccine, if you notice a reaction, go to the nearby health facility. Sometimes there will be fever, and like the HPV I saw in one of the schools in the Pinsville Belt, the girls are already, jittery, seeing their friends at the head of the line, screaming because of fear of the pricking that will happen on the arm. Before they reach the table, they're already afraid. They may have to, some of them tend to have some little level of fainting spell, but those ones will go away spontaneously by themselves. So vaccine may have reaction, but the management structure is there. Report it, then we'll work with you so that the actual action can be taken, because we've seen in some places where the swelling may develop at the site of the injection or vaccination. They do some home remedies, and that is not good. They start to do warm compress, they take hot water, they wet the towel, they press the side, and rest of it. Some people even apply chalk or herbs. These things can cause complication because where you deliver the needle, it creates an opening between the outside and the body already. Then you put in those products. You are saying just report back to the health system wherever you are, and the steps will be taken upward for the right action to be derived.
Yeah, Nevin.
Are the vaccines available to all health facilities across Liberia?
All health facilities where we offer immunization services. So as the immunization program is concerned, in Liberia, we have approximately 735 health facilities that are offering immunization services, including private, public, and just limit. So they are offering, wherever they are offering these services, you can go there and find the HPV vaccine there. It has been there all to us since 2019 to date.
And to ensure that the vaccines are available at every level of the system, in addition to what we have at the national level that we call our national core store, we also have regional cohort that will store the vaccine to be closer to cluster of counties so that you do not have your stock finishing before the time allotted, or clients will not come to you for vaccine. Then you say, oh, this vaccine is not there today. So they are available.
All right.
And one thing that is happening in Liberia is that all of the pharmaceutical products that are brought in country, we have a regulatory body.
LMHRA.
Good.
Thank you.
And they are responsible to ensure that all of the products that are brought in the country are assessed and they are good for use before they accept them to use them. So even with the immunization program or vaccines, we do the same. They have to approve that before we can let any vaccine be used in Liberia.
There is something here I want to get an understanding on, and I know people out there too would like to know. Uh, uh, Here you have something that has to do with you said yes, granted, you can take one or two doses, which is granted, but with the issue of the uncompromised girls.
For the
Immunocompromised.
Immunocompromised girls. When you say immunocompromised, and they take the vaccine 2 doses and per 6 months, right?
yes. So let me
Just hang on there.
Mhm.
That clarity will come.
Okay.
Just hang on.
let me just speak to that. We call them immunocompromised.
Mhm.
For example, people who have HIV, people who have nutritional issues as well, people who their immunity is compromised. For those kind of people, when they are being treated in hospitals, and we notice that you fall within our category, then we tend to increase your vaccine dosage from 1 dose to 2 doses with 6 months interval. So after 6 months, you come back. We reschedule you when we give it to you today. We reschedule you after 6 months. You come right back and we give you the second dose. What we are doing is that we also trying to help to increase or build up the immunity because the immunity is already being compromised. So we give the kind of people 2 doses.
So maybe some of our old man in downwater side or in Douala, the word immunocompromised may sound so big, but the body has a system of fighting against germ that a person may carry. So the fighting soldiers that in your own body are what we call immunity, to be able to fight by yourself. And because your own immunity, your fighting soldiers are not strong, like a military warfare, or your military is not trained, anybody can invade you. So because your body must stand to respond to the HPV, because their own system is not stronger, we need 2 doses minimum for them so that they are able to turn that vaccine into protection for their bodies.
Okay. Now let's see something. Because a woman or a girl will not just sit and just get and just get this sickness, right? This disease, and it comes about through sexual intercourse. And not, but why only the girls are given the vaccine when the boys or the men are prevented from taking the vaccines?
And I mean, they have been described previously as the carriers.
I think in this case, the terminology carrier may sound very strong. We say in men, the condition does not show symptom, even in late age, except where I mentioned earlier for other parts of the body.
Okay.
But just to clarify, HPV can be given to male.
Okay.
USA, Canada, Australia, and those other affluent societies, because resources are closer to their population, they are able to shoulder their own health burden as a country. They are able to provide vaccine for the entire population of the adolescent, both male and female. But what we do for our part of the world, Liberia being among other countries that have other description, we go for what we call vulnerable group, the people who are most affected. Resources are not enough. If Gavi comes today and say, I give you 80% cost to cover your vaccination for prevention of the human papillomavirus in girls, and government has only 20% to contribute now, the best buy is we go and cover the population that is most threatened. Maybe in future, our program will graduate to go for boys, but for now, it's for girls because they are the one in the spotlight carrying the womb where the baby is supposed to come through, and they are the one that are being killed by the cancer disease. They are the one that are spending money. Their parents are spending, so we're still preventing girls first. Then later on, maybe we'll graduate to another level.
Yeah, and so let me add to my colleague. The males, yes, like we said, they can also get it, but male doesn't have a womb. They do not have service, the service. So there is no service. The one who has the service. So for instance, if there was the disease here, who first you will see coming down with the condition would be the female because she has a service. She will be the one dying, and the male will move around with the condition You will jump to go on a football field, play football. No even fever that you will have. The HPV have various strains, but the one that affects the womb or the cervix is the one we are speaking of. So the people who are mostly affected are the females. So our priority is to protect the females from getting the condition because they will be the first dying if even if they come down with such condition. If, even according to statistics in Liberia, the number of cases diagnosed of the total number of cases diagnosed of cervical cancer, more than 50% that we have not heard any female dying from cervical cancer, only any male dying from cervical cancer. So the females are the one dying. So our priority is to ensure that we vaccinate the females. That's why we decided to do that. And like Niwe also said, resources when they are scarce, we look for the more vulnerable person. That's why we do this.
Okay. So most of the time, or okay, let me just say that when it comes to health, it's everybody's business.
Mhm.
Learn how to take ownership of your own health is one important step that anybody can take. And most of the time, these myths sometimes they start from different places, from the internet, and then they enter into the communities. The woman I never understood that big word, somebody they explain it, and the information just fly before you know it taking over. So I'm saying that to say that in as much as it starts from there into the community, the places where we go to get people vaccinated or protected and all that, it means that communities leaders have role to play. So can we talk a little about the role that community leaders and other people have to play when it comes to this process?
So I like how you describe it. And without bragging for Ministry of Health, I think this is one arm of government that has a very well-defined community structure, the Community Health Assistance Program. And we are using that in immunization to make sure that our vaccination coverage improves or we reach the last mile child or woman to be protected. But with role assigned or expected, and this is one strategy that HPV before the introduction, we ensure in the demonstration phase, the religious community, the educational folks or the teachers, education ministry, gender ministry, and wherever part of the community you find yourself, we all have a role to play, even down to household, the parents, we all have a role to play. So the call we are making to action is that the HPV vaccine is here to protect our girls. It is safe, it is free, it is effective. So take this message to your neighbor, to the next neighbor, that the vaccine is waiting there. Except that going forward in the coming days, the campaign is over. We go back to our routine age to vaccinate only girls from 9 years to 14 years old. The rest of the upper age, 15 to 18, are no longer going to enroll until at such time later on in some years to come. Then we'll go again because it will find from our data to say number of girls that should account for the vaccine over the past couple of years, we are not getting them. Then we may go back to that multi-age strategy to make sure we protect the girls at the point of protection before they can reach the screening age.
Okay.
So, like my colleague said, we are calling on all of our parents, our guardians, education, and all land ministries, including partner as well. We are calling on everybody. The vaccine is not a new vaccine in Liberia. Remember, we introduced it, we demonstrated in 2016, and we introduced it in 2019. Since 2019, it has been in a program. We'll be doing vaccination across the country. Even if you look at the global statistics for number of countries that have introduced HPV in their routine system, we have 131 countries across the world that have introduced HPV vaccine. So the vaccine is useful, is good, is effective, and let us go for it to prevent our girls from cervical cancer.
Okay, Melvin,
No,
anything from your end
maybe-
before we open the phone lines?
Maybe we can take the lines now to hear from the public because
Okay. So if you just joined us, you're listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. And we're in talks this morning with Mrs. Dole, Supplementary Immunization Activities Officer, and Mr. Nure, Coordinator, Advising Safety Surveillance at the Ministry of Health. Well, we are talking the HPV vaccine this morning as well as cervical cancer. So to be a part of this discussion, I mean, you heard our guest, the vaccine is safe, the vaccine is good. And to be a part of this discussion this morning, you have questions, you have recommendations, you have things running on your mind that you want to contribute to this program. You can call us on 0880-514-096, 0880-514-096, 0775-677-376, 0775-677-376 are the numbers to call. Call us this morning and be a part of this discussion. Melvin, you can also check the online platforms.
I'm finding it difficult with my internet here. That's what I'm trying to search on. But you can speak with this person.
Okay. Good morning.
Yeah, good morning.
Good morning. Your name and where do you join us from?
Yeah, this is Obaro. Can I call you from Parallel Community?
Go ahead.
Yeah, the vaccine in question. EPD, we have been seeing posts from some Nigerian residing in the USA and around the world, sending information to people in Nigeria, especially parents who have taken a vaccine, then do not even allow their children to take this. Reason being, America who carry a large number of cancer sicknesses, of cancer virus, their children are dying every daily basis. They are not giving such vaccine to the children in the in large number. So they just going to take the way you are doing in Nigeria. It's not happening. Now, people are saying that they are bringing problems that tomorrow the children will face serious problem, health problem in the country. So they are advising parents to not allow their kids to take the vaccine. So I really want to know if you people have received such message on the social media, what is the advice to the parents who have received the message? Thank you.
Okay, our guest will respond to that concern. 0880-514-096 is 0775-677-376. Good morning. Good morning. Good morning. Okay, Melvin,
Sorry.
that call is on hold.
Let's take
Okay.
this person from here.
Good morning. Good morning. Your name and where do you join us from?
My name is Anthony Langford and I call from Afro Maryland County.
Go ahead, Anthony.
I first applaud your studio guest. I think they are up to the task. I mean, that's just what professionals do. I'm so excited to see to do, especially my Oman Institute. I just remember again that do or something like that. I think you guys are doing well. Well, you need to extend your public relations, your civic education for people like us because people like them who don't understand, especially from lawyers who are asking questions about or the function of the vaccine. So you need strong civil awareness to train in your talent, in things, and also program understand. But on the surface, you are doing well. And thank you very much.
Okay, 0880-514-096, 0775-677-376. Good morning.
Good morning.
Yeah, can you just walk away from the child a little bit? Go away from that child small. I hear you, boo. And then walk away from your radio.
Good morning.
Drop the line.
0880-514-096, 0775-677-376. We can still take more of your calls right here on the program. We have few online followers here, but let's go to the line and talk to this person.
Good morning.
Yeah.
Your name and where do you join us from? Go ahead.
Yeah. So I want to thank you people
who's somewhere to convince our people here that this is not good. This is the same old thing when the COVID came, and some of them refused to see the party. And some of them say, oh, I'm not going to the party now. So I want to to my Nigerian people not to listen to those that are out there. Everybody has the option. If somebody do it, fine. But the party is the best right to do, and it's good for our girls, my children, my grandchildren, okay. So I want to encourage the Nigerian people to channel in their numbers and take the party to listen to those that are out there. Instead, and then listen to the practitioners of Nigeria. Thank you very much.
Thank you very much.
Thank you. Thank you. Enjoy you can. I want to read from LNTV Liberia Live page. I'm finding it difficult to get to the ministry's page. I don't
Yeah,
know
go
what's going
ahead
on.
from that side.
So this one says I'm Porto Sally. I'm following ELBC from Painesville Woodcamp. Hi guys, Solomon FD. That's Solomon FD writes in. It says, "Hi guys, please ask your guest: is the HPV vaccine harmful?" A man in the USA posted on Facebook warning our girls not to take it because it is harmful. Even though maybe he just joined us late, but he clarified that. Ezekiel Gamoyu Yapa Jr., rising from Virginia, Central Virginia, Monroe, Monserrate County, says, "I'm following you people live." Gaddafi Zegwe is also following from Nimba County, Sanikoli, precisely. And Willem Berber passed away. I'm following live from Kansas City, Nimba County. As we get more of that from the official Facebook page of the Ministry of Health, we will read you all the concerns from the people watching us online across the world.
Okay, before our guests start to respond to the callers' concern, we have few people from the ministry's platform. Emily Menti is saying, "Thank you so much for educating our people out there." And then we have Ezekiel. "I'm following from Central Virginia, Monterey County." Daniel is saying, "Great job," and more. So we will stop here for now, and then we go back to our guests to respond to the callers' concern. So back to you.
Thank
Mr.
you.
Miri.
Yeah, thank you. I will begin with Mr. Cannon, who mentioned the issue of the post on social media. And that is where our own professionalism is maintained. We are not here to debunk what comes from social media. We tell you what is professional, what is scientific, and what are the advantages of this vaccine we are discussing in preventing this deadly cancer of the womb. Efforts are on our way through the ministry structure, through our communication and health promotion unit, that the highest level ever of the senior management team of the Ministry of Health will do an official response to all of these things you are mentioning on social media. So we don't want to be dragged into that. And that is where I come to bring Mr. Bean, who has launched the appeal already that people should not follow the social media. The Society of America is not Liberia. The services that America have for healthcare, we mention some of them. If Dr. Smith, who's especially at JFK, is listening, the treatment for cancer, America has cryotherapy. They do radiotherapy for cancer control and treatment. But here we only do screening for now, meaning we are just going for what I may call the tip of the iceberg. You are just seeing a minute portion. We don't want for it to progress to a state that you will need a high-class treatment that Liberia does not have. This vaccine we are using, Ministry of Health did not enroll it single-handedly. We have structure. Let's already talk about the Liberia Health and Medical Product Regulatory Authority. They are our counterpart. They do the licensure for whatever vaccine we're bringing. But above that level, we are working with a group we call the National Immunization Technical Advisory Group, the NATAC. This is a body made up of specialists, pathologists, and different specialties at this body. Ministry of Health through the EPR will go and present the disease burden. What are the fights for which this vaccine must come? When they see the need plus the advantage of doing the particular intervention of vaccine, they will give the go-ahead following licensure for the LMHRA. And before the vaccine even come into the country, we also will go to the World Health Organization. They have a system that we call pre-qualified listing. They will say, yes, go here, yes, go there, and this is the vaccine based on the need of the country.
And let me add to the answer to this question as well. I mentioned here that we have about 131 countries across the world that are using this vaccine, where we have the very US themselves using this vaccine as well. So it's not only Liberia. This is not only Liberia that is using the vaccine. The America, where the person is speaking from, is also using the vaccine as well. Thank you.
Then to Mr. Lanford, we say we thank you for your point. We'll step up our game in terms of the engagement of public relation effort, health promotion, messaging, and awareness. That is why we are strengthening our demand generation at the county, health facility, and community level. But your message is well taken.
Yeah, so just give
Yeah,
us
party
your
comments.
party comments and then.
And somebody mentioned about it being harmful as well.
You want to provide a little clarity on that?
Where when I deliberated, I said
Yeah,
the
yes.
vaccine is safe.
It's not.
The vaccine is actually safe. It has been used since when in the country, and we have not heard about any issue that came up as a result of the vaccine. So the vaccine is safe. What Nure just explained is that before the vaccine, any vaccine is introduced into the country, we have a lot of bodies that can approve. We call it the WHO pre-qualified. They can say yes, this one is okay, meaning that it has been tested and it's being approved by the World Health Organization.
Okay.
And then we also have the NACTA that
Okay.
approves these vaccines. Thank you.
Okay.
Thank you.
Mr. New, your parting comment.
Thank you. And thank you to those on the sound of our voices and even those that are following on social media. Your day is not wasted. We are saying campaign is over, but immunization continues. We go back to our routine services where we provide the same HPV vaccine to girls 9 years to 14 years. So please take your child, please take your daughter, and please encourage your neighbor. Thank you.
All right.
And let me say thanks also to our listening audience, to our supporters, partners, the Ministry of Health, and even the government of Liberia that have supported us and is always supporting us.
Okay.
Let me mention that we were able to achieve 665,000 as our coverage.
Okay.
Thank you.
Okay. So go ahead.
Yeah.
Neville.
So before you close up, let me just read from the Minister of Health. That's the Minister of Health Facebook page. It says yesterday the Ministry of Health received a new team of foreign doctors specializing in various surgical disciplines. Their arrival will help strengthen Liberia's surgical workforce and improve access to quality health care across the country. The doctors are expected to remain in Liberia for a minimum of 10 months. The remaining 8 of the 20 doctors are scheduled to arrive later this week. And this vital support has been made possible through assistance from the World Bank. Under the direct supervision of Minister Louise Maplekoto, Minister of Health, and her able deputies and technicians. Good work.
Of course. Good work. She's very hardworking, and we see that every day. So we'd like to say thanks to the minister and congratulations to us all Liberians for the milestone. So with that, this is how we'd like to leave you on to this edition of the program Roadway to Health. Many thanks to our guest, Mr. Augustine Nure and Mrs. Elizabeth J. Doe for sharing such valuable insights this morning. The vaccine is safe, it's very safe. The campaign is over, but immunization continues. So take advantage of this opportunity and get your girls' children protected this morning. AB Salif has been here taking us live. We have been your host, Angela Noah, and
Melvin Stewart. And thanks to Damawa Fofana, also who has been carrying us live on LNTV, Liberia Live, across the world.
okay, until next Tuesday, have a good day.